I'm a clinician. I started my career almost 20 years ago, always on the clinical side. I was a clinical provider, a therapist for kids and adolescents, always in the nonprofit world. Um, for 10 years, I was the clinical director of a nonprofit program for 8 years before moving into a private practice position and then eventually ending up in a clinical outreach position. And there was no better fit for me than family first, because it really gives me the opportunity to do both, not only dip into all my clinical knowledge, have contact with the families because I support them through the pre-admission process, but also use my business sense, my creative sense, people skills, relationship building. And what I love most, I think, is to highlight, and I understand exactly the quality of treatment that we have at Family First. And I love showing that to the community, to the world, educating people also, not only on the services we have, but on the clinical sophistication that we offer to our families and kind of educating everybody on that as well.
And
So,
from a family first perspective, what does that journey look like from when its origin of how it started to where it is today?
yeah, so we are coming up on our 10-year anniversary this year.
Yeah.
We were founded by two clinicians, Ben Cecil and James McManus. They are still on the daily involved in absolutely everything in the office, growing this program really set to revolutionize adolescent treatment. Coming from treatment where they saw adolescents being treated in a behavior modification model. They set to absolutely change that. And we have developed a program that is non-punitive, non-behavior modification based, and very clinically sophisticated, rich program, very comprehensive but compassionate, and I always call it yummy. People make fun of me because I use the word yummy, but it is a very warm, loving setting where you want to send your children. As a mom myself, I wouldn't want to send my child to a treatment center where they weren't treated with love and respect. And that's exactly what we do, is we treat the kids with love and respect, and it's a very non-shaming environment. So we take that stigma and the shame out of them having any type of feelings, reaction, and behaviors, which is what they're dealing with. We have our chief clinical officer is Mike Geresi, and he is a healer and a amazing trauma therapist, and he has created the model of therapy that we use specifically for adolescents to treat complex trauma, heal developmental trauma. And we use that combined with CBT and DBT and EMDR and other modalities to really treat not only the kids, but the whole entire family. Our identified client is the family. So we want to create a family shift. So the kiddo that's with us as, residential client, when they come back home, they're able to thrive and succeed in that environment. And they're not feeling as though they are being sent to a program to get fixed. We are treating the entire family in a very unique way. So the parents have a treatment plan that's parallel to the kids' treatment plan. There's a family therapist, there's a clinical coach, there's a case management, there's an educational coordinator, there's like a whole entire team surrounding the entire family that works throughout the stay of the program, that really takes care of the family while they're with us, to make sure that all their needs are being met. It's really like a wraparound services type of program.
Mm-hmm. And
Uh,
so your staffing, how many clinicians do you have currently?
so I don't know the exact number. However, we have 10 homes, and I believe each home has at least 4 clinicians.
So so they stay in residential homes? Is that what happens?
Yes.
Oh,
Yeah.
wow. Okay.
Yeah.
Okay.
So
Wow.
we can treat 60 kids,
Okay.
a little bit more. However, they're divided into 10 residential homes.
Oh,
Each
okay.
home has around 10 kids, and each home operates as its own program.
Wow.
So if your child comes to Family First, they're in that home with those kids, and they don't really have a lot of interaction with the other homes. So they're with that, milieu, that little group of kids. And we're able to separate the homes based on ages, based on presentation, not so much on diagnosis, because that's not how we view the kids, just based on diagnosis. But we, for example, have a home for kids that are a little bit older, right? Because we treat kids between the ages of 13 to 18, even sometimes a 12-year-old if they're appropriate. So sometimes we'll have, no, we have a home that's specifically for the older kids. And then we have a home for the younger kiddos. A 13-year-old is not necessarily gonna jive with a 17, 18-year-old.
Right.
We have a home that is for kids that have more experiences with substances. And then we have a home where they have never had any experiences with substances, that are primary mental health.
Okay.
And have not had any exposure to substances. And we're
Okay.
able to keep those kids in a home together. So when they have group together, they can join better. They can discuss the things that are more permanent to their issues that they're dealing with. And we have a home that is specifically for neurodivergent kids and kids that are on the spectrum. So it's a very, I would say, individualized program. And we can place your child in the home that's going to be best for them.
Okay.
And best for your family.
So when you think about the sort of the evolution of Family First as an organization, it's in Florida. Its home flagship is in Florida. Was it intended to be a program that was going to be a national program that people would learn about and come to? Or was it originally designed to be a regional program that would draw from the local market?
Originally, it was regional. Originally, it started as an IOP.
Ah, okay.
Yeah. And then James and Ben saw the need for residential. The kids needed a higher level of care. They needed a longer stay. They needed more stabilization. They needed to individuate from their families. They needed that separation. They needed the chance for the parents to work on their own things while their child worked on their own things. And as they saw the need, they built the program around that. And they started with one home. And then slowly it turned into 2, then into 3. When I started with Family First, that was a little bit over 3 years ago, we had 4 homes. We had just opened the 4th home.
Mm-hmm.
Then in the 3 years that I've been there, we slowly opened a fifth and then just recently opened a sixth.
Okay.
So very intentionally and very slowly, we have a way of expanding the program to
Mm-hmm.
where we never ever jeopardize quality of care.
Mm-hmm.
And
Yeah.
as we see the need, we grow.
Uh-huh. And so from a marketing standpoint and a business development standpoint, it was originally looking at the local market to draw in engagement, but then subsequent now you all are marketing as a national program. Would that
Correct.
be correct?
Yeah, we
So,
have kids coming from all over the country.
okay. And obviously showcasing the expertise of your internal team is going to help with that marketing and help with that business development approach, because talking about your licensed clinicians and the work that they're doing, talking about the clinical modalities, I guess where I'm going with this is that when you think about what's drawing call volume into Family First, it's a cross section of the work that you're doing in business development, but then also how do you communicate out the brand and the message and the uniqueness of Family First to others nationally? And where is that leading into the potential work of TPN and how it has potentially to be able to serve as a brand engagement piece for your organization, communicating out your expertise through your teams, through trainings and workshops, and then also how to utilize the service as a resource for your internal staff for continuing education and monitoring. And so I guess my big question is that do you find that TPN has the potential to be that additional resource for lead generation?
Yeah. So what we want is to set us above the rest as far as being the best clinically, right? And the way
Mhm.
that we can do that is obviously by continuing to deliver that clinical care to all of our clients,
Mhm.
but then also educating the, you know,
The industry as a
the
whole.
industry as a whole. Thank you. Yes.
Yeah.
Um, from our own clinicians and from Family First.
Mm-hmm.
So educating and setting us above, right? The rest, not only in conferences, but also through webinars, through events,
Mm-hmm.
through different things. And then also educating our own clinicians. I
Mm-hmm.
think, spend a lot of time, a lot of money, and resources in making sure that our clinicians get a lot of training, a lot of supervision, and a lot of advancement. We have a lot of young clinicians that come to work for Family First. It works.
Mm-hmm.
They have a great rapport with adolescents and kids. They like working with kids. Kids also like seeing a younger clinician, but then also it's awesome because you get a fresh mind and and we love giving them that education.
Yeah.
Even if it doesn't mean that they're going to be with Family First forever, right?
Right.
But
It's a great benefit. I mean, from an employee standpoint, you're offering them education to help further their professional development, which in many cases is more valuable than just pay.
Yeah.
So prior to adopting TPN, which you all are fairly new with TPN, probably within the last 6 months to a year or so?
Yeah, I think it's been a few months. We just had our first event last week.
Okay, I'll be interested in hearing more about how that went.
Yeah.
How many continuing education programs were you doing prior to coming on board with TPN?
I would say we were doing maybe we were co-hosting a lot of them, and we were doing if it was a conference, um one or two a quarter.
Mm-hmm.
Yeah, I would say one or two a quarter.
Okay. And
Yeah.
then from an attendee standpoint, when you do these live events, what is your expectation for attendance? Are you looking at, 50 is a good number or 30 is a good number for attendance? I mean, what were usually your goals when you would do these live events?
Local events, if it was just a local event that I was putting together locally, um, I would say 50 was a great number.
Okay.
Yeah, for a
And
local,
then
for a
how,
webinar,
yeah, for the webinars.
I would say in, 200, 300 people.
All right. And you would get those numbers.
Yeah, especially if we were co-hosting.
Okay.
So,
Can you talk to me a little bit about post follow-up for those types of events? What happens after the workshops are over when you guys would do them?
um, that would be a responsibility of the person that was hosting the event. So if I was hosting the event, I would send a thank you email, a follow-up email with, gratitude for coming to the event, and then a little bit of information on our program. And if anybody had any reason to reach out, they would have my information.
Okay. Does any of that data get passed on to marketing to add into your mailing list, your mailing automation system, where they are now part of your newsletters or part of any of kind of correspondence that you all are putting out? Does any of that go into the top part of the funnel for that?
We are responsible for keeping our own at this time.
Okay.
So I have my own spreadsheets with all attendees that have ever attended anything that I've hosted in the past.
Okay.
Yeah.
Okay. And do you find that you get any solid lead prospects when you do the live events? Are you getting good return on your investment when you do these workshops?
Yes.
Okay. Talk to me a little bit about what that looks like from a referral engagement standpoint of somebody going from a conference or a workshop that you host to making a referral. I mean, do you follow or track that at all? Are you seeing any kind of, is it fast? Is it, touch points are made? Do you have specific touch points in place between when they first come to a workshop to when that first call comes of like, I follow up at least once or twice after the event? Or is it just a one-time follow-up? Thank you for attending. And then you kind of nurture that relationship on a cadence.
Yeah. If it's a conference, it's a little bit different, right? If I was presenting at a conference or I had one of our clinicians or chief clinical officer presenting at a conference, it was a national conference, that's a little bit different. If we're going to talk about a local event, most of the time there are different touch points, there are different follow-ups. A lot of times it's also me after that doing one-on-one meetings, tours, different things, and I can track a referral a lot closer to that. If it's more of a national conference, it's much harder to track the exact, at what point that connection made. A lot of times it's also it could be someone like, oh my God, I attended this conference and I heard Mike Gerasi speak, and they're for Family First Adolescent Services, and they were talking to someone else, and you just never know exactly when they heard you speak.
Sure.
So those are harder to track.
Okay.
Conferences are just harder to track.
Yes.
Unless you get a referral while you're standing at a conference.
Yeah.
Or a direct follow-up from a conference, and you're like, I know I met that person at that conference and they're sending me a referral. That could happen fast, or that could happen a year later.
Right. So do you have a conference calendar that you keep? Do you guys set your conferences out a year ahead of time or 6 months ahead of time to say, these are the conferences we're going to go to this year? Do you plan that out?
I do.
Okay. And in that, do you know how much you all are spending per conference?
Ballpark figures.
Okay.
Yeah.
I mean, when I used to plan conferences, we were averaging anywhere between as low as 2,500 to sometimes up to $5,000 per conference. Would you say that that's pretty accurate?
Yes.
Okay. And knowing that because where I'm getting at with this is that when you have a hard time, and conferences serve a purpose from a industry awareness standpoint, but from an actual ROI standpoint, sort of the big magic thing is like, how do we actually know it's making a difference? How do we know that it's actually generating leads? Would you say it's the lowest generating strategy that you're using right now for lead generation? That it's more of a marketing visibility, like we're here, this is who we are, know who we are kind of thing, versus using it as a tool to actually generate new lead prospects?
That's a really good question. I mean, I see it as a whole.
Mm-hmm.
So if you take that part out, I feel like there would be a big part missing. I think it's almost like it has to be a combination of both. You can't just do the conferences. I think you would get nowhere.
Right.
Without doing a lot of the like really dedicated follow-up one-on-ones, building the relationships. So much of the conferences, if you don't do the follow-up, then the conference means nothing.
Yeah. Yeah.
So really,
true.
the time that I put into the conference itself, it's time consuming, it's exhausting. You're working like long days, but actually the real work is when I leave the conference and the follow-up of all the connections I made, all the people I met, set up one-on-one, set up tours, send emails, document. That's really where the work comes in. And so much builds from that. So it's hard to put it into a little compartment and say, I mean, for someone in my position that has more, I guess, of a national role, it's important to do the conferences.
Yeah.
It's very hard to track ROI. It's so hard.
It is.
I tried,
No.
I tried, but yeah.
It's tough. It's really tough. And I know that sometimes our leadership looks at us and goes, why are we making this financial investment if we don't actually know it's going to yield a referral? And sometimes there's the intangibles, right? You've got the tangible of somebody who learns about you at a conference and then makes a phone call, but then you've got the intangibles of just the visibility of people knowing that you exist. It's the supporting the conference. If you're going to NAATP, it's saying, hey, I support this organization because I believe in it. It's going to a NATSAP conference and saying, I'm supporting this association because I believe in it. And then I always used to think that if you're not there, people are wondering where you are, so there's
I know. It's being a leader in the field too.
Yes.
So
right.
If you have a person that's seen as someone that represents the company in a really, respectful and with a lot of integrity, and I think that if they're connected, it's just good for the company to have someone there that they can that people can trust, right? If it's NATAP, if it's whoever it is, it's like it's a lot. Sometimes it's a little bit of politics, right? Sometimes it's
Well, and for the purposes of TPN, because one of the things that it's trying to suggest is that if an organization made the decision to forego one conference in lieu of choosing to do a package with TPN.health, could you reasonably have a stronger ROI in being able to acknowledge the people that attended the event, the lead generation from those events, knowing that you would be able to have direct contact with them because they participated, which then gives you, a higher level of return because you're making that investment. Do you envision that TPN could be that kind of substitute for some aspects of some of the conferences that you do, and or just one conference? I mean, if it decided that it wanted to, if Family First said, well, we're going to go forego this conference in lieu of doing this with TPN to see maybe even how it responds or how it yields return versus the conference that we've been going to where we really don't know, could that be beneficial for TPN?
Yeah. Yeah, if you're looking at it budget wise like that, yes.
Mm-hmm.
I don't know if I would put them in the same department or compartment, like,
Okay.
TPN and conferences.
Mm-hmm. Okay, tell me more.
Yeah, I mean, I see conferences as one thing, and then I see TPN as something else. So it's another type of visibility. It's another like vertical that you're putting out. Webinars, CE events, local. You're able to do your own conference. Really, you guys are able to organize, a conference just on the name of the treatment center, like, so I would almost put it differently. I wouldn't say just to name a random conference, but I would just, no, I'm not going to go to Cape Cod. Instead, I'm going to, and I wouldn't even do that comparison in my head. I would do different, because I would think for my goals for the year, if it was like, these are my conferences, this is what I'm going to do. I'm going to submit a presentation at these conferences because I'm going to speak at them. I'm going to go and market and speak and do this live and then do all the follow-up. And then my goal for webinars and local events to provide CEs, that's the TPN, vertical and goals. So it's like two different, for me, would be
different strategies.
Two different strategies, would meet two different goals for me.
Gotcha. Okay. That's super helpful to know. And I appreciate that, because that gives us some perspective and understanding where you're at when you do your strategic planning. So what prompted you all to decide to join TPN.health? Was there a business challenge that you were looking to solve as a result of selecting TPN.health?
Yeah, we were never CE providers. So that's the reason we did a lot of co-hosting and collaboration. We usually we were co-hosting with other providers that were providing the CEs, and we were doing that part. So when we started learning more about the fact that you facilitated not only the CEs but the sign up, the assets, the marketing, you had a platform, we're able to grow and network through the platform, it made a lot of sense for us.
Perfect. Okay. So it did help solve a problem, because some of those CE accreditation groups are just painful to go through the process. So they took a lot of that away for you. You didn't have to manage all of those pieces.
No. So for the event that we just did on Friday, we submitted the presentation to you guys, and it was really seamless. I mean, you created a link for us to send to all of our list of people that we invited, and we could post it online. We could post it on social media. We could send it via email. You created a bunch of assets that we could post through all social media platforms plus email. And everybody signed up through there. You provided a reminder a day before. Then the day of, there was a QR code that people just scanned to sign in, check in, and that was it. You took care of the rest.
So would you say that you saved 25% of staff time by utilizing TPN to help with those particular events? Otherwise, you all would have had to do it yourself?
Yeah.
So percentage wise, what kind of time savings do you think that it created for you and for your team as a result of working with TPN?
Yeah, I would say, yeah, 25% sounds good as far for that event, for sure, even a little bit more.
Oh, great. Okay.
For the specific event.
Yeah, absolutely. What services does TPN offer that they provide to your organization? What are your favorite features of what it offers? Is it the on-demand? Is it the tracking? Is it the CE wallet? I mean, is there something specific that TPN is offering that really kind of sets it apart for you all that you really appreciate it?
I think this answer might change for me as I get to know TPM better and work with you guys a little bit more. Right now is probably the event planning and the CE planning ability
Okay.
to put an event together. I've been helping the rest of the team put events together, and we have 3 more planned coming up. And it's now they're kind of flowing. They're even a little bit easier. We know exactly what to do. We know what to expect after we've done the first one. So far that's been probably my favorite feature so far, but I have not played yet with the platform as much or been able to interact as much on the platform. So I think I have to
Yeah, it's
do
still
a little
new.
bit. Yeah.
Yeah, that sounds good. Okay. So, and you probably haven't been able to see this yet because you all just did you do your first event recently?
Yeah.
So looking at what the potential lead generation or marketing efforts could come from working with them, have you been able to see any benefit around that yet?
Not yet. What I can say is that, everybody was really happy with the event that came to the event. It was a local event, and it was a lot of clinicians that we knew and some that we didn't. And we got a lot of positive feedback. And we did have a great speaker too, but everybody seemed to really like the process. So
Right. Good. Okay. I guess the other question, you kind of talked a little bit about this, but I was going to ask you to kind of paint a before picture of what it was like, the work that you all did in planning events before TPN and then after in utilizing the platform. And you sort of spoke about that already in saying that you all were really doing a lot of the heavy lifting in all of the planning and execution, but it sounds like it's gotten easier now that you're working with TPN. Is that accurate?
Yeah, I would say that would be accurate. Okay. It's helpful to have the assets made as well. Right now, we're going through a transition where we don't have a graphic designer on the team. So it's nice to also have that.
Yeah, that's fantastic. Yeah.
And to have a link where you guys track the attendees and we can just go on the platform and see who signed up.
Great.
All that is nice and keeps it all very organized.
Yeah. Yeah. Has TPN helped at all with any of your business development or outreach team efforts?
Well, as you know, it's supporting it, right? Like we are all the events that we're doing, not only are we educating, but we are also doing it as part of our business development plan. So it's definitely supporting all the events.
And creating any kind of opportunities for new leads?
I think we have to see. What I would love to see is us having attendees at the events that didn't come from us, but came directly from TPN.
Yeah. Okay.
But we haven't done a webinar yet. So we haven't done like a national webinar. I think that might bring like way more people, obviously, than a local event.
Mm-hmm.
The local events that we're doing, we are sending out the invitation ourselves.
Okay. Got it. So you're more in control of the local events, but the national events, you'll take advantage of more of their database of who they have within their platform, because they have 40,000 clinicians and groups nationally that are signed on that
Yeah.
they can market to.
Yeah. And then if we do one of the events and we do them on demand, then we could see who views, right, our demand.
Yep, exactly.
And then we can do a follow-up with people that view our webinars on demand.
Yes. Yeah, so there's still a lot of untapped potential for sure.
Yeah.
My last question is, would you recommend TPN.health to other behavioral health providers?
Yeah, absolutely.
Yeah, and why?
If you need something to support the team and help them get to the next level and want them to host CE events and have more of a clinical touch, I think TPN is the way to go.
Great.
There's a lot of teams that I think can host events, but hosting a clinical event, I think, is a little bit different. And so I think that's where TPN can really come in and support that and change that.